Hello, my name is Madeline Parmley, and this is my Module 8 assignment for CIS 450, Professor Kim Warren, and the topic of this presentation is virtual healthcare visits. In this presentation, I hope to cover why virtual healthcare visits are important, what the available research is, the ethical and legal issues surrounding these, and the plan for implementation, and any impact of technological advances in the future. To start off, what are virtual healthcare visits? Very simply, it's a means of providing healthcare remotely utilizing a variety of telecommunication platforms. These can include telephones, smartphones, and mobile wireless devices. Why would this be important? Well, the implementation and the utilization of virtual healthcare visits can increase access to healthcare. They provide convenience, they help reduce healthcare costs, they can address both acute and chronic conditions, and it means that you can access this virtual healthcare from any mobile device. Well, how can it accomplish all of that? Virtual healthcare visits can come as little as $50 for a visit. It gives you expanded hours of access to healthcare providers by not limiting to staffing a full clinic. You can monitor chronic conditions through mobile diagnostics, wearable sensors. For the 2 million elderly that may be homebound, the patient's home can be the site of their visit. It's important to note here that in today's day and age, it can take up to 20 days to get a 20-minute appointment with a provider. And with added wait time and travel, that can mean 2 hours. So if it can be accomplished anytime, anywhere, this could greatly reduce the impact of the waits that are required in order to access any type of primary or acute care. The available research. There are video conferencing for management of heart failure. In a study by Baus, Foz, Batten, and Whitmore, there were substantial reductions in hospital and emergency department admissions utilizing this video conferencing for heart failure patients. Telehealth and virtual visits have improved access to rural and frontier areas. This was a study by Stingley and Schultz, 2014. And the virtual visits for the management of uncontrolled diabetic patients. Improved patient satisfaction and access to multidisciplinary team. This was a study by Robinson, Branham, Locklear, Robertson, and Gridley in 2016. These patients, instead of waiting until things got really bad, they were able to intervene at an earlier possibility. Any type of early intervention that can lead to fewer hospital and ED admissions is a positive for us in healthcare. And if access to healthcare is an issue, the use of these virtual visits, especially when coupled with diagnostic monitoring, can help keep patients out of the hospital. Rural patients face hurdles when having to travel just to get the care they need at the nearest medical facility. These folks can be affected by no cell phone reception, snow, icy roads, blizzards. The population in these Midwest states, in this study by Stingley and Schultz, is estimated to grow older at a disproportionate rate than other urban areas. So these folks who are in these rural areas are actually, the age of their population is growing larger than in other areas. So through utilizing these e-emergency services in that study, 1 million residents in rural communities that spanned 495,000 square miles had video remote access to board-certified emergency medicine providers for the very first time. In that study, 72,000 patients were treated utilizing e-emergency. Obviously, some of the ethical and legal issues facing the use of virtual visits, health privacy. Obviously, finding a platform where health information remains private is paramount. Utilizing technology requires the organization to ensure they're protecting the patient's information first and foremost. Informed consent. Documenting informed consent for these visits also has to be factored into the process. From a workflow standpoint, since there's no physical signature at the time of the visit, documenting this in a verbal manner would be important to create. Patient identification. That would include verifying you have the right patient identified through utilizing the same identifiers you would use in an office visit. Confidentiality. The confidentiality of patient information would need to be assured through proper information technology frameworks for limiting access to this information, the same as you would in an in-office visit or environment. Positive patient outcomes. Creating positive patient outcomes would need to be a priority. That only issues that are deemed acceptable to be assessed and treated in this virtual environment are included. This is where provider competence, our next issue, is paramount, as the ability to triage appropriately and care for patients through this medium requires education and competence to only treat those patients who do not require further diagnostics or labs in order to proceed with their care. Plans for implementation. First, you have to define the program. Virtual acute care visits for virtual patients to meet with the real provider. They would be meeting with the real provider utilizing this technology. It would still be a provider and a patient meeting, but it would be through this medium. The platform. It has to be video-driven patient care, utilizing webcams, smartphones, tablets, where the provider and patient can see one another. Provider training. It is imperative that the knowledge and the skills to be successful in caring for patients through virtual visits be emphasized through appropriate provider training. Part of the implementation is going to have to be a dedicated website and printed materials for the launch to inform patients of the services offered. It does no good to launch this program if patients don't know that this is accessible. And whether that be from the primary care providers' offices, through websites, through patient portals, but making sure that the patient knows this is available to them and the cost benefits of utilizing this when appropriate has got to be part of that implementation process. Now, this program would be for low acute care visits, such as one sees like in an Express Care or Zoom Care. Those are some of the names utilized out there. So this would be used to diagnose and treat things like fevers, coughs, colds, flu, headaches, sore throats, sinus infections, laryngitis, pharyngitis, bronchitis, eye infections, rashes, reproductive health, and urinary tract infections. As part of defining the program and provider training, the scope of the program must be clear so that providers have clear parameters of what they should be treating in this setting. According to a study by Weig et al., 2014, the training for providers and staff involved in virtual visits remains lacking. This poor training can lead to poor patient safety and care outcomes. So if we're trying to meet those objectives, we have to make sure that we have proper training so that we can meet those positive patient outcomes. This program does not necessitate the use of cameras. This program does necessitate the use of cameras, both in patient identification and for assessment and treatment decisions. A well-designed website, along with printed materials that provide concrete information as to the program, its cost, and its scope of services, should be developed and tested prior to launch. What are some of the possible pitfalls during the implementation phase, and how can you avoid them? Leadership support. You have to have champions for this program, and you have got to have buy-in and support from your leadership, from your organizational leaders. The rollout. The organization would have to decide whether to implement a gradual rollout or an all-at-once approach. This can be different areas of the organization, beginning before others with utilization, or it can be rolling out phases of the system piecemeal. It makes sense to have a test site where troubleshooting and problem solving can begin prior to rolling out to everyone. Reiser et al., 2015. There has to be a focus on training. As I've said before, the timing of the training from months ahead or the day before launch have to be included. Reiser et al. Noted that they found training earlier in the process allowed time for the users to become more familiar with the system and practice prior to implementation. No one wants to be that patient who is utilizing a provider who has never used the system before. There should be a vibrant test environment where those people who are going to be utilizing the system, the providers who are going to be utilizing it, have had ample time to become familiar with how to navigate through the different pages in that process, and to make sure that they feel comfortable before they begin with patients. There needs to be ample support at go live. Proper support with specialists and super users at the ready was found to be important. For those clinicians who need the additional support, providing at-the-elbow support to make sure they know how to use all the tools and workflows is really critical. If there's anyone who feels they still need that, it needs to be available and at the ready when this program is launched. Having at-the-elbow support increased their adoption and use of the system. Flexibility. New workflows take time to adopt and develop into standard work processes. And if there's not that flexibility to make sure that everyone can have that time in order to make sure that they are comfortable with those workflows, they may not adopt this. Documentation tools. Again, goes back to that training, the use of new templates, dot phrases, copy-paste functions, pre-populated text areas. They're great additions, but they also pose learning curves to utilize correctly. This requires training and support and can absolutely be an area where at the elbow can be beneficial. So what is the impact, possible impact of technological advances in the future? Obviously, one of the concerns is this intuitive healthcare or Big Brother? They are coming out with the ability to monitor diagnostics such as blood pressure, blood glucose, anti-coag factors, and oxygen levels with remote or implanted devices. So someone can monitor you, a patient, and know what's going on with you, maybe even before you do, and contact you with those early interventions. Access to healthcare providers 24/7. Obviously, one of the that is a positive and a negative. We want to increase access to healthcare, but at the same time, we also have to recognize we have to have enough providers to give access and to provide that care if it's going to be 24/7. The ability to assess cardiac emergencies via smart devices. This is something that's already being done. And if someone knows you're having a heart attack before you do, or can see those early signs and create those interventions, again, the impact of advances like that currently and in the future can save lives and create positive outcomes, and actually provide greater health care in the long run for patients. So to conclude, access to healthcare is a major concern in today's healthcare landscape. Whether it be the lack of availability of primary care providers or the cost of visits, these all pose a roadblock to timely patient care. The implementation of virtual visits to treat minor illnesses and injuries could provide solutions to both of these pressing issues. It could act to prevent unnecessary hospitalizations or emergency department visits. By allowing patients to take proactive and cost-effective steps in managing their healthcare needs via healthcare dollars, access and care quality can be improved.